Hello, it's Jon Ashworth here, the Shadow Health Secretary, and can I send my apologies that I can't be with you today because of the important trade union march in London. But can I say I'm absolutely delighted that the Socialist Health Association is establishing a branch in Nottingham. Hopefully Leicester will be next, where I'm the Member of Parliament. And can I thank the Socialist Health Association for all the work that you have done in the Labour Party and the Labour movement over many, many years. This year is the 70th anniversary of the creation of the National Health Service, a great Labour creation. But let's remember, it was the Socialist Health Association, or rather its predecessor organisation, that pushed the motions to our Labour Party conference in the 20s and 30s, calling for a universal public health service covering every man, woman and child. And that's what a Labour government achieved in 1948. And I, as someone who aspires to be the next Labour Health Secretary in Jeremy Corbyn's Labour government, want to restore that universal, publicly provided, publicly administered National Health Service. An NHS where we say no to privatisation. An NHS where the Virgins and the Sercos are not milking money and profits from our National Health Service. An NHS where we're investing in our health service again, where we're investing in staffing. So rather than the overstretched, overwhelmed, understaffed NHS, we have an NHS providing the quality of care that every patient deserves. And that means looking again at how we deliver healthcare across the country. It does mean integrating and working more closely with social care, but it doesn't mean American-style accountable care organisations, undermining the fabric of national pooling in the NHS and allowing a situation where, because of the Lansley reforms, could mean more private sector involvement. Indeed, it could mean handing over whole swathes of NHS services to the private sector. We want a public NHS. But I think we've also got to go further as well in other areas. We've got to do more on mental health services, deliver the parity of esteem that we've long promised. The next Labour government will actually deliver it. I think we have to do more on addiction services in society, which have been severely cut back because of the changes to public health in this country under the Lansley reforms. And we've got to end privatisation by looking at the structures of our NHS again as we restore, reinstate a public NHS. And my commitment to you as an SHA is to work with you closely over the coming weeks and months about how we do indeed reinstate the NHS. Because I want, as a Labour Secretary of State, to introduce an NHS reinstatement bill which delivers that universal NHS which was at the heart of its vision 70 years ago. And then finally, one of the big challenges facing us as a country is the widening health inequalities, where life expectancy is actually going backwards in some of the poorest parts of the country. While child health outcomes are so much worse in this country compared to other Western nations. We've got to do better than this. I want to be a health secretary who, yes, rebuilds capacity in a public NHS, but also a health secretary who leads an all-out assault on these widening health inequalities. So again, I want to work with the SHA and how we tackle health inequalities in our society. So I'm sorry I can't be with you today, but I extend my solidarity to you. I hope you have a successful meeting, and as we campaign for the NHS and we remind people that it was a Labour government who created the NHS, let's also remind people that it'll be a Labour government in the future led by Jeremy Corbyn who will restore, reinstate and will renationalise a public National Health Service. Have a good day.